Trying to book a COVID test through the city's website will bring you to this page. Demand for appointments in Hamilton is high. At this time, there are no appointments available online.
What we are seeing is that they are booking well out. That is due to the number of people who are coming forward for testing.
It's prompted new guidance from Hamilton's medical officer of health.
To address this backlog that we're experiencing, we're very much asking individuals who are symptomatic with symptoms consistent with COVID-19 or those who have had the opportunity to get tested and have been found to be positive to go ahead and self-isolate and notify their high-risk contacts immediately of their COVID-19 status, because the case managers may not be able to reach you.
And if you're contacted by someone who's tested positive,
please isolate and monitor for symptoms, even if you're fully vaccinated. I know previously the advice had been that those that are fully vaccinated could go ahead with their daily schedules, but because we're seeing transmission even amongst those that are fully vaccinated, please stay home and isolate.
It's the same situation for Niagara residents.
Obviously, if we're not able to test everyone, we're not going to be able to find all of our cases and follow up with them or our contacts. And so people are going to voluntarily have to just stay home and let their own contacts know going forward.
And it isn't just case managers and testing sites that are feeling the pressures. The CEO of the Medical Laboratory Professionals Association of Ontario says 95% of labs processing the tests are short-staffed in this province.
We don't have a system that can actually handle all this testing. A perfect example is our premier asked us to hit 100,000 tests a year ago. The highest we ever got was, I believe, 77,000.
The labs are analyzing close to 60,000 PCR tests a day and working overtime to do it. Their biggest concern is that they're starting to see turnaround times affected with regular testing outside of COVID.
So this means cancer results, this means infection results. This is everyday testing that we're starting to see a delay in results.
And there have been growing calls in the medical community to treat a positive rapid antigen test as a definitive result, avoiding an additional PCR confirmation.
Right now, we are still recommending follow-up of those RAT tests if they are positive to ensure that is the case. However, it's also a reasonable approach to stay home and do that contact notification that we've just talked about.
We're going to see a complete explosion of our numbers of cases. And tests are going to have to start to be prioritized to where it informs medical decision-making. Anybody who has symptoms of illness just needs to isolate, stay home, and that's going to be it going forward for the next little while.
Hamilton Public Health says they are working with the province on new guidance to ensure those with the highest risk are prioritized for testing, including those in congregate settings tied to outbreaks. Dr. Richardson telling us there will be a further update in the days ahead.